Well, good day. It's June 2025, and I'm Andy Meyer, proud to be in my 10th year as the program director at Temple University Hospital. I always say that a program is not as important as its program director. A program is absolutely defined by its residents, so I'm happy to turn this presentation over to two of our best first-year residents, Courtney and Janine, who are going to take you through our recruitment spiel here.
Hello, everyone. I'm Courtney. We'll get things started with just a brief overview. So, we are a 3-year podiatric medicine and surgical residency, and we have the added credential in reconstructive and rear foot and ankle surgery as well. We cover a variety of institutions in the Philadelphia area, main hospital being Temple University Hospital in North Philly, and then we also cover inpatients and emergency department patients at Jeans Hospital and Episcopal Hospital, as well as some different Philly area private practices. Of course, the TUSPM Foot and Ankle Institute, and also rotate at UPMC in Williamsport. We have a very unique surgical experience here at Temple, which is one of the main reasons why I wanted to come to this program. We see a very large quantity and variety of cases, and we also pride ourselves in the high quality of procedures that we perform. We have the cool opportunity to operate within a level 1 trauma center, so we get a very wide variety of operative traumas as well. We're a very busy consult service at Temple Hospital at the 3 main campuses that I mentioned before, and referrals from FAI and our outpatient case base makes up a large amount of the volume and variety of our surgical cases that we see here at Temple. Of course, we've got lots of our bread and butter forefoot surgery. And of course, like our open bunions and hammer toes, but a lot of our attendings are also using lots of minimally invasive techniques, which is cool. So we get to see a lot of that as well, which is very up and coming in our bread and butter section. And of course, lots of trauma and rear foot surgery as well. We see open fractures, compartment syndrome, GSWs, or gunshot wounds. There's really no shortage of trauma in North Philly. We get to see lots. And then very expansive reconstructive rear foot procedures, including flat foot and cavus recons, as well as Charcot recons as well. So we really get to see it all.
Okay. And then when we're discussing points of pride for our program, we also like to emphasize the Diabetic Limb Salvage Center, which is the first tertiary level program that is solely dedicated to the prevention of lower extremity amputations. Our faculty helped found this limb salvage center at Temple University Hospital. And so we have weekly conferences with our vascular surgery team at Temple to devote our efforts to limb preservation. And this also includes multidisciplinary management with other teams at Temple and throughout the hospital system, including cardiology, nephrology, infectious diseases. And obviously anyone who, can help play a part in preserving these patients' functions in their limbs. When it comes to our surgical numbers, I think something that we like to emphasize is that we've just completed our transition from a 4-year program to a 3-year program. And so the numbers that are seen here are reflective of the achievements of one of our soon-to-be graduated 3-year residents who accumulated over 600 cases and over 1,000 procedures over 3 years. He was one of 4 chief residents, and typically we only have 3 residents per year, and that'll be the norm from here on out. So these are a little bit diluted, but I think that he would like to think that these are a point of pride as well. And so with respect to our off-service rotations, most of our time during PGY 1 and 2 is spent on service with podiatric surgery. But with that said, we have approximately 5 off-service rotations per year. Our first year includes infectious diseases, the emergency medicine rotation, internal medicine, anesthesia, and pain management. And then our second year includes trauma surgery, burn surgery, vascular surgery, as well as rotations with medical imaging or radiology, rheumatology, and behavioral science or psychology. Our third year is spent entirely on service with built-in rotations at the UPMC Williamsport location. But there's also options for additional elective rotations. And so some of those include private practice offices, as well as the limb salvage and wound care center, endocrinology, pathology, plastic surgery, other specialties that we have previously rotated with, or other specialties not listed here. Again, Temple being a level one trauma center and a large hospital within Philadelphia, we have a lot of opportunities for learning through the hospital system. And then when it comes to our teaching and learning opportunities, our academics boast a unique setup. So we have a structured 36-month curriculum that's designed to cover any possible topic that might be covered on our board examinations that come at the end of residency. Our dedicated boards prep starts strong in our first year of residency with practice exam writing questions, practice with the computer-based patient simulation format, and dedicated scientific reading. We hold our academic sessions twice a week, and those range from journal club, radiology rounds, grand rounds, socials, and hands-on labs, which you can see pictured here, which we all always have a great time with. And then we also have the TUH Practice Center for the Advancement of the Surgical Arts. This is a dedicated surgical skills laboratory, and the practice time is available to residents at any time that we might want. So this includes open labs, practice with sawbones, hardware, K-wire, and then also an arthroscopic simulator for some fun hands-on practice. And of course, extra practice and creativity and time dedicated to honing in and advancing our surgical skills is always encouraged. As we're affiliated with Temple University Hospital, we also have very easy access to the facilities at the Lewis Katz School of Medicine. So this is actually very conveniently across the street from the hospital, and we can have monthly cadaver labs to allow us to practice our surgical dissection and our surgical techniques. Our attendings and our faculty make a vested effort to be present for guidance, but we're also encouraged to practice as much as we possibly can, and we can do so on our own. And it just helps us gain our confidence and continue to build our skills outside of the operating room. When it comes to our faculty and our faculty here at the program are involved in nearly every aspect and every professional organization within the realm of podiatry and podiatric medicine and surgery. So some of those include ACFAS, ABFAS, AO, APMA, and NBPME. Our faculty are always eager to help us residents find opportunities for involvement that match and can contribute to our interests. And then with respect to alumni, we have graduated residents who attended podiatry schools other than TUSPM, and we are exceptionally proud that 6 of our program alumni are now program directors across the country, and 1 is also a fellowship director. So we have a very robust alumni network across the country and annual reunions at the ACFAS Annual Scientific Conference, which you see pictured here.
I want to brag about that a minute. It's June 2025, and Dr. McGlamry recently passed away. I'm not sure what time you guys are going to be watching this video, but I was doing some digging in the archives and saw that Dr. McGlamry rotated at Temple University Hospital and Episcopal Hospital when he did a residency back in 1955. So I can't claim him as an alumni, certainly. That wouldn't be appropriate, but we are extremely proud of our alumni. And if you think about the contemporary aspect of our program since the turn of the century, we've graduated 66 residents, and as Janine said, 6 and maybe 7 now are going to be residency or fellowship program directors. So that's about 10%. So our faculty and our alumni have really gone on to do great things with the profession.
Thanks, Dr. Meyer. When we're talking about unique scientific opportunities, this is another bragging point for us, is our emphasis on our contributions to science within the profession. So we participate annually in the scientific literature review with ACFAS. We also routinely investigate and publish our clinical scientific findings in journals such as the Journal of Foot and Ankle Surgery, as well as the Journal of the American Podiatric Medical Association. We like to present our findings at major conferences, including the ACFAS Annual Scientific Conference, the APMA National, the Regional Goldfarb Conference, and others. Most recently, two of our residents won first place at the ACFAS Annual Scientific Conference here in February 2025. And then we also routinely participate in peer review for the aforementioned podiatric medical journals. And here you just see a quick summary of our 10 residents for this academic year and the production that we have had with respect to science.
So another benefit that we have being residents at this program is we're able to reap the benefits of being affiliated with both Temple University Hospital and TUSPM. So we receive funding from both of those places to go to different conferences and courses throughout the year, which is a really big perk. So some residents attend ACFAS, of course, every year, APMA, the Baltimore Limb Deformity course, AO, ACFAS Scopes course, and really anything else at our discretion with, of course, institutional approval. We have an annual educational stipend that's added to paychecks that we can use at our discretion. We normally get that at the end of the year. And it really just demonstrates a dedication to advancing our skills and service in the profession. Such a great looking group of residents. So these are going to be the upcoming residents for 2025, 2026. Our new PGY1s, Jess, Dan, and Daria, PGY2s, which are of course me and Janine, as well as Kavya, and our upcoming chiefs, Ralph, Asma, and Sarah. So some more perks, again, like I mentioned before, we get benefits from being affiliated with both TUSPM and Temple University Hospital. Our pay is very competitive and it increases kind of as you move up the food chain. We also have paid health insurance, which I think is pretty unique to Temple. I didn't rotate as a student with a lot of hospitals that have this, but essentially, if you go to any Temple facility, our health insurance is covered. Nothing comes out of our paycheck every month, which is wonderful. If you want something additional, you can, of course, you have that option. But our base insurance, which is really great, is free for us every month, which is wonderful. What else? So we also get the title of an adjunct faculty member at TUSPM, which is great for your CV, especially if you want to go into academia someday. And it's a great experience just getting to work with students. Honestly, it's something that I didn't know I would love so much, but not only working with students in clinic, but also in different workshops throughout the year with our faculty. It's truly really, really great. We also get free parking at the hospitals as well as TUSPM, where we meet twice a week for academics. Which can be a huge cost, especially when you're in an urban area. Parking can be upwards of $300 a month. So it's a huge perk that we don't have to pay for that. We
Yeah,
also
I don't get free parking at either of those spots.
gifted parking. We also get regular meal stipends at our hospital. So we never really have to pay for lunch, and the hospital food isn't too bad. We get 15 days of vacation every year, as well as a couple of personal days and sick days. We get reimbursed for our license, which can be very expensive. So that's another perk. We have access to the Temple facilities, including the gym and the library. And also for our international students, we do sponsor visas, which is important. And then, of course, work-life balance. This is something that's really important. Residency is tough, and it's just really nice to be able to kick back and hang out with our co-residents. I feel like we're all very different, but these people have truly become my family, and I very much enjoy just after work going to a social and having a beer. We'll bring our significant others, and we just have lots of different seasonal activities and academic socials. And it's just really nice to get to work hard and play hard as well.
I guess this is my lone part here, but there's lots of things that residency directors should do in terms of things that residents need, and I'm pretty proud of being able to achieve all of those. And I think residents get everything that they need from our program. But I always think that life is a balance. Sometimes you're used, and sometimes you use. And if you want to be happy, you should use more than you are used. Now, residency, you get used a lot. There's no two ways around it. But I honestly view my job as program director is to be used more than I use the residents. So I try and go above and beyond and be there for not just what the residents need in terms of absolutes, but also to support individual actions, support individual plans, and be with the residents, not just while they're residents with us, but here and beyond.
So now I'll just touch on the clerkship experience here at Temple Hospital. We welcome clerks from all podiatric medical colleges. We will have very high expectations for you with your month with us, but that's a good thing because we really want to teach you how to be a resident and what your life is going to look like once you're in our shoes. You'll have the opportunity for lots of hands-on learning with exposure to a variety of surgical cases and access to all of the main hospitals that we operate at. And our goal is to really give you a full sense of what residency is like here. We want to be as transparent as possible. And I think that's really important. I think some places may try to kind of hide what they're really like, and we want to show you exactly what it's like to work here. So you'll cover a weekday shift with us, you'll cover a weekend call shift with us. You'll get the opportunity to do lots of labs, um, as well as just really will let you kind of see consults with us and presentations and just really give you an idea of what it's like. Um, you'll have to give a couple of presentations, 2 to 3 5-minute presentations, as well as a 15-minute presentation at the end based on the monthly topics that Janine touched on earlier in the presentation. And like I said before, we take great pride in teaching our clerks every month. We really enjoy having you be a part of the team. Um, and we all love to teach. So come spend a month with us.
So that's our program. Like Courtney said, we really welcome anybody who's interested to come and spend a month rotating with us. If you'd like to visit or if you have any questions, please reach out to us. So the residents run the Temple externship account email that you see there. And then Dr. Meyer and Dr. Sansosti, who are our program director and clerkship director, are always happy to answer any questions as well. So thanks for looking into our program, and we hope to see you rotating or visiting us soon.